Hi, everyone. Welcome back to the Pre-Med Scenes Summer Seminar Series. This is session number 3. We'll be discussing the methods. So today is quite a deep dive. We could probably have an entire series on the methods section alone. So for anyone with deeper knowledge on the methodology of clinical trials, there'll be some detailed content we can't cover today. But I'm going to go over the general gist of it as it relates to our tympanostomy study. And I'll discuss 3 overarching principles that are important to think about with clinical trials that I'll call rules of thumb. Also, make sure you have the study with you to look through as we go through this. All right, so we have a lot to get through, so let's get started. All right, so before we begin the deep dive into the details of this section, always make sure to keep in mind that what the general purpose of each section is, and of course, what the general purpose of the whole study is, right? So I like this quote on the screen here. Birds see the bigger picture while frogs observe the important details, which emphasizes the importance of both types of vision in anything we do, right? And when we read clinical studies, we must be both frogs and birds so that we can understand the details, but also understand the big purpose behind those details. I'll go into this concept a little bit more at the very end of the series because I just think it's a really important principle just for life in general. All right, so let's get into it. The deepest dive is the methods. Today, we'll talk about the design of the study, the measurements, or what we call the outcome measures, and then a very teeny tiny bit about statistical analysis. Okay, so the design. Who are we studying here? Who is this study about? Let's define this population. All right, so here is page 1789, first page, abstract. So here we'll see the patient population. Who is this patient population? Well, it's young children, right? So it's a group of children ages 6 months to almost 3 years old. But not only that, it's a group in the age range who's had at least 3 ear infections in the past 6 months or 4 infections in the past 12 months, right? So these are young kids who've been getting repeated ear infections over a short period of time. So that is called, in the study, it's called recurrent AOM. Remember last session, AOM is acute otitis media. So these children have had recurrent AOM. And keep your eyes on that section of the abstract because it also says that this group of children is then randomized to be in one of 2 groups. A group depicted on the left who receive antibiotic therapy, they call it medical management, and the group on the right who receive tympanostomy tube placement, okay? And it's very important to understand that these assignments are completely random because it's that quality of the study is what boosts the integrity of the results. It makes the results more reflective of the different treatments. And most importantly, it randomizes the variables. Whoa, what are variables? All right. So an independent variable in this study is the treatment. And the dependent variable in this study is the health outcome, right? And in a perfect world, the treatment will directly lead to the outcome. So in other words, the outcome depends on the treatment, right? But we don't live in a perfect world. In the real world, a phenomenon called confounding variables and bias affect this relationship, and we need to understand this. So I'll go into it really briefly. So what's a confounding variable? It's a variable that affects the relationship between the independent and dependent variables. So for example, if you test asthma in hockey players versus soccer players in the summer weather is going to affect the asthma differently in the soccer players versus the hockey players whose environment, a cold hockey rink, is just the same in each season, right? And then bias is an error in study design, recruitment, data collection, or analysis that results in a mistaken estimate of the true population parameter. An example of this would be performing a political poll in an area that's like overly Democratic or even overly Republican, right? It doesn't fully represent the whole population, right? That's called selection bias. But it's important to remember that because real life is messy and complex, and bias can never fully be eliminated. But a randomized controlled trial like this one here helps to minimize it. Okay, so another concept. If you read the whole method section, you know that although two groups were randomized to two different treatments, some of them, and this is important, some of them received the other treatment. They ended up with the other treatment for a variety of different reasons. Why? Well, because again, real life is messy. We'll talk about that later. But I want to bring it up because it's important. It brings me in my first rule of thumb for a clinical trial. It's called the intention to treat principle. Okay? It says that the analysis of the results of an experiment is based on the initial treatment assignment and not on the treatment eventually received. And this is important because it ensures that the analysis does not follow the circumstances of the imperfections of any study, where participants drop out or end up getting the opposite treatment, called attrition and crossover, respectively. Okay? But you're probably thinking, whoa, but we want to test what people actually got and how they did, right? But you have to maintain the integrity of the randomization of the study. And if you start measuring results based on only the end numbers and the final group numbers, then you're eroding the randomization of it. So the point is that the randomization of a study has to be upheld. You can do secondary analysis as well, and we'll get into that in the results. All right, so participants, here it is, page 1790 and 1791. All right, so here's a great flow chart as to who it was that they studied. There were children between 6 and 35 months with recurrent AOM, okay? Who did they not study? Those with past surgeries, like past PTP, past tympanostomy, adenoidectomy, and tonsillectomy. Those with a chronic illness, those with a congenital anomaly that can increase the risk of AOM, those with chronic bilateral otitis media, and those with sensory neural hearing loss, okay? Because those could be confounding variables, and they would create a bias in the study. All right, tables. This is another rule of thumb. So when you are reading any clinical study, any clinical trial, table 1 is always going to be the characteristics of the study subjects and the groups. Okay, table 2 is always going to be the results. Pretty much, that's a pretty good rule of thumb. Okay, so this is table 1. You can see that it's the selected demographic and clinical characteristics of the children according to the treatment assignment. So this shows you the distribution of all the patients, of all the children, their ages, their locations, the study locations, and other qualities such as sex, race, ethnic groups, etc. Okay? All right, let's get into the timeline. So here's the second page of the study. Do you see this? Okay, 1790. Now, right there on the right, near the top, that's where it tells us the timeline for the study. So it was implemented in a 5-year time period, but each child had 2 years of follow-up after their treatment. So let's put all of this on a real timeline. So first, the study subjects were selected and randomized, okay? That's at the very end of that flow chart right here, okay? That's right before it splits into 2. The study subjects were selected and randomized. Then the subjects were assessed by the clinician, okay? And they also had assessments every 8 weeks for the whole study period. Then they received the treatment. Then they received the continual 8-week follow-ups. And then after 2 years, the trial ended and they measured the outcomes. And here's the investigator's timeline again. I think this is just a great depiction of walking through all the steps. And that is in the study. All right, so let's talk about the design. Believe it or not, clinical trials actually have several different designs, if it's not complex enough as it is, right? But a randomized controlled trial, which this is considered the highest level of study. Third rule of thumb. So what it's saying is that randomized controlled trials are the optimal study design to test cause and effect. It does the best job at trying to eliminate all outside factors to figure out if A causes B, right? So let's look at it briefly on a ladder of different study designs. As you can see here, there are two analytical studies at the top. Okay, so these are papers, the ones in purple. These are papers that collectively analyze and review a large number of studies about a particular subject in order to come to a conclusion of that subject. But as far as original scientific studies are concerned, RCTs are at the top. Below that, you have cohort studies, case control studies, case series, case reports, and then the laboratory studies that do not involve human subjects are at the bottom. I am not going to go into all of those different study designs, but I do think that they're very important. So if you want, and you want to learn about those different study designs, here are some great resources on YouTube that I found and that I have used in the past. Stomp on Step 1 has a video, Let's Learn Public Health has a video, and ATP has a great video. So go to those if you really want to look at the different study designs. Now I'm getting into the size of the study. This is pretty straightforward, okay? So let's look at this flowchart again. So in the beginning, we have 1329 subjects at first, right? That's a lot of subjects. But after all the exclusions, after excluding all of those who didn't meet the criteria, they ended up with 250 subjects. And it's right here as well on page 1793. All right, you see that? Okay, so let's talk briefly about the outcome measures. So what exactly were they measuring for these little patients of ours? What did they define as success or failure? Those are called outcome measures. So now let's look at the bottom of page 1791 and then the top of page 1793, okay? This is where they define what exactly they're measuring. They're called outcome measures. And with outcome measures, you have primary outcomes and secondary outcomes. So let's go over it. The primary outcome that they are measuring in the study is the rate of AOM episodes per child during the 2-year follow-up after their treatment. The secondary outcomes are the percentage of children with treatment failure, the time to a first episode of AOM, the frequency distribution of episodes, right? So how often they were receiving those episodes, the percentage of severe episodes, days with tube otorrhea or systemic antibiotics, diarrhea or diaper dermatitis, antimicrobial resistance, quality of life assessments based on family questionnaires, parental satisfaction with the treatment, and the use of other resources needed by the family. Okay, so those are all outcomes that they're measuring in this study. And this, I'm just giving you a little peek. That's what the results are going to look like. That's table 2. Remember I said that information about table 1 and table 2. This is table 2, so it has the results. All right, but we'll look more into that in our next session. All right, let's talk very briefly about an analysis. I'm not even going to talk about p-values quite yet, but we'll talk about statistics a little bit. So I like this quote from Mark Twain. It says, "There are lies, damn lies in statistics." And I'll talk about that in a minute. Page 1793 at the top right is where they speak briefly about the statistics that they use. So all I really want to tell you right now about statistics as you head into the results section next time. First of all, you don't have to know all the statistics. You don't have to know how they got what and why. All right. You can look up a p-value. That's pretty important. Okay. But what's really important is that the quality of the statistical analysis in a study can vary a lot. And investigators have used statistics many times over history to shape the conclusion that they want. So it's really important to make sure that study design and the analysis is done properly so that the results are a true reflection of what occurred. So let me give you an example that the news does a lot on TV in order to turn heads, right? So here's an example of the high school graduation rates over time with a particular community intervention. Let's say the graduation rates went from 55% to 65% in a certain community. Okay, results, right? Not, I mean, good, but not jump up and down amazing. They're still certainly subpar. But what if we have the same exact data, but on a different scale? See, the instant reaction would be, wow, that's amazing. That program really worked to help the graduation rate. But it's still just 55% to 65%, right? So keep that in mind always when you read any statistics at all. We'll get more into the numbers next time. But just keep that in mind. Do your best to read the results section. I know it's numbers heavy. It's okay. We'll talk about it more next session. I think that's it for this week. If you stuck with me this whole time, great job. I'll see you in the next session. And as always, email me if you have any questions at all or you need help with this at the email on the screen, and make sure you subscribe to our YouTube channel and on our website. I'll see you all in the third video.